Ang susunod na programa ay rated PG. Patnubay at gabay ng magulang ay kailangan sa mga batang manonood.
Good day everyone, welcome to Global Health Report. I'm Dari Pagantian, bringing you a comprehensive look back on one of the most defining moments of our generation, the COVID-19 pandemic. From its global spread to our local experiences, we'll explore its impact, challenges, and stories of hope.
Is a disease caused by the new coronavirus. Know the symptoms. They include fever, coughing, muscle pain, shortness of breath. What can you do? Wash your hands with soap and water for 20 seconds or use an alcohol-based hand rub. Avoid touching your eyes, nose, and mouth. When coughing or sneezing, cover your mouth with a tissue or flexed elbow. Discard tissues into a closed bin and then wash your hands. Maintain a distance of at least 1 meter between yourself and someone who is ill. Seek medical help if you have symptoms. Wear a mask if you are coughing or sneezing. Check trusted sources of accurate information. Remember, the best prevention is to keep you healthy and follow these safe steps.
Let's begin with a global overview of the pandemic. COVID-19 first identified in Wuhan, China in late 2019, rapidly evolved into a global health crisis with over 600 million confirmed cases and more than 6 million deaths worldwide. Its impact has been staggering. The virus spread quickly across continents due to travel, dense population, and the highly contagious nature of its variants, such as Delta and Omicron. Now, let's shift our focus to how the pandemic affected our nation and local communities. For that, we turn to our first reporter.
As the latest data of our country recorded over 4 million confirmed cases of COVID-19 and more than 60,000 deaths. The government responded with nationwide lockdowns, community quarantines, and mandatory testing. Checkpoints, troubles, and restriction became part of our daily life. Our healthcare faced unprecedented pressure. Hospitals reached full capacity and medical supplies such as PPE, oxygen tanks, and antiviral drugs were in short supply. Health workers worked tireless, often risking their lives. We spoke a few locals to gather their experience during the height of the pandemic.
So my experience during the pandemic wasn't as good as it seems. I think it was mainly stagnant. I don't think there's something such as improvement coming into my life for that one. My lifestyle definitely wasn't as active, physically and mentally, academically as well. I've been inactive during that time. Basically, the pandemic worsened that state. Even before the pandemic, it was not that great. And the pandemic kind of just worsened that one. So my activities definitely, while there's video games, there's a lot of laying in bed, there's a lot of staying at home. So not as great of an experience as it was, but I guess people have it worse. People have been in worse situations, and I've been grateful enough that I was living under a roof at that time. So that's why I was able to stay at home and stayed as safe as possible. So that's my experience with that one, for that whole pandemic experience.
during the COVID-19 during quarantine is medyo big impact siya sa ako since like daghan jud changes and everything, like especially sa academic kay ako kasi personally ako kay more in visual jud talaga ako, dili ako makatuon like self learning, and then since nag-quarantine is nag-modular kami in tungod ato is like wala kayo ko ay natun-an ato na time, so kato lang, and then daghag adjustment kay of course laagan mangug ko niya kato nga quarantine, so kailangan lang talaga magstay sa houses for our safety, so mao lang.
Sa ako naman po sa quarantine kay ang ako ang mama is ano siya, nurse siya, and then nagatrabaho siya og healthcare. So sa amo ang balay kailangan jud na higpit kayo ang amo ang cleaning, mga inana, like sa amo ang balay na pa may katong murag pang disinfect gani nga machine kay akong mama mo good nursing, so sa tanang gimok na mo dapat maglimpyo may inana.
Okay. So during pandemic kay super nag-struggle kayo ay ko as sa pag-eskwela o sa pagtuon kay very lisod kayo mag self-study that time, kay ako kay mostly makatuon ko if F2F ang klase, and mas limited lang among movement sa community.
And now, back to you, Dabi.
Thank you, John. Those voices truly remind us of how deeply personal this crisis has been.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solution.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Umistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
B-I-D-A. Be the solution sa COVID-19.
Joining us next is our health correspondent, Dave, to talk about the vaccine response.
Yes, Dabi. The arrival of vaccine in early 2021 marked a turning point. Our government secured doses from different manufacturers like Pfizer, Moderna, and Sinovac. Initial rollout was prioritized for health workers, senior citizens, and those with disabilities. Public response was mixed, some embrace it. Others hesitate due to misinformation. But nationwide, education campaign helped build trust. Eventually, millions received full doses, boosting our collective immunity. During the pandemic, several safety protocols were put in place. Mandatory face masks and face shields, physical distancing, and frequent sanitization. Travel was heavily restricted. International flights were limited. And even local travel required passes and permits. People adopted remote work, online schooling, and virtual gathering, becoming the new norms. Despite the isolation, communities found creative ways to stay connected. Back to you, Dabi.
Thank you, Dave. The economic toll was immense. Thousands of businesses were closed. Many Filipinos lost their jobs or had reduced incomes. Small vendors, jeepney drivers, and service workers were among the hardest hit. Aside from the economic burden, mental health became a growing concern. Prolonged isolation, fear, and uncertainty led to increased anxiety, depression, and emotional stress. But even amidst the chaos, hope emerged. We saw people help each other, community pantries, online fundraisers, and volunteers supporting frontliners. The spirit of Bayanihan showed through. Aside the world slowly opened up, recovery efforts began, and people started rebuilding their lives. As we reflect on pandemic, we carry lessons of resilience, compassion, and unity. While the scars remain, so does our strength as people. Thank you for joining us in this special report. I'm Davi Palantian. Stay safe and take care.